for those of you with shoulder pain, we're going to talk about what muscles you need to release prior to your workouts if you do have shoulder pain during exercise. All right. These are the most common ones I find in people to be tight or dysfunctional, and they most likely have no idea those muscles are like that. Well, not most likely. They never have any idea how bad their muscles are until there's pressure applied. All right. So these ones are ones you need to start paying attention to if you do have shoulder pain. With exercise or without exercise, doesn't matter. Okay. First one is the pecs. The pecs is the one I always try to stress to people the most about needing to remember to release the tension and stress that muscle. Okay. Because the muscle is so large and it does a lot throughout the day. Even though you don't realize it, your pecs do a lot. All right. So they do the actions they do shoulder flexion, they do horizontal adduction. So they bring your arm in this way, and they also do medial rotation. Now, the medial rotation is the one I want to talk about the most, because the other two muscles that I'm going to talk about, they also do that medial rotation. Okay. So if we rotate medially like this, you see the backs of our hands here. So if you are someone that when you walk around and the back of your hands show, if you're just standing or walking, that is a sign you have tight medial rotators. All right. So you got tight pecs, you're going to have tight lats, and you're going to have the tight subscapularis. Okay. We'll talk about those next. But why that's important is because if we walk around with all that tension, especially in our pecs, what's going to happen is these guys will stop performing the actions we need them to. Okay, so there'll be overactivity, there'll be a lack of blood flow, lack of oxygen, all that good stuff. There'll be a lack of that in that muscle, and it's going to cause your deltoid to take on that brunt of the work. So a common complaint of especially guys is that when they do bench press or they do their shoulder work, or chest work, a lot of what they're feeling, they just feel it in their deltoid, so they don't feel any activation in their pecs. And what happens over time, if we don't work on releasing these muscles that are causing that medial rotation, what is going to happen is our bench press could decrease. You could get less range of motion when we do our back exercises. Push-ups, we may be able to do a lot less than we used to. And all of that could be due just from these guys not activating when we need them to activate during those movements. All right. So imagine if these guys are nice and functional, we're not getting a lot of tension in there. All these muscle fibers are activating. Of course, we're going to start seeing an increase in our reps. We're going to see an increase in our power, less stress on the shoulder. Okay. So all of those things will start to reverse the more and more we start releasing the tension that's formed in our pecs. All right. So if you have that medial rotation, if you have shoulder problems when you do your bench press, you need to start working on releasing the tension in your pecs. All right. I promise you, if you have shoulder problems, take your hand and you can kind of just press around, get some good pressure on your pecs. It's probably tender. It might be a little painful. All right. You probably didn't know it was there, but I promise you it's there. So start releasing your pecs. You can use a ball, so a myofascial ball, a lacrosse ball, whatever, and put it against the wall around the floor and just roll it out and move your arm around as you're rolling out that muscle. So you can get the different muscle fibers and different ranges of motion when you do that release work. All right. So definitely start getting that muscle. This next muscle, same thing. I included the anterior view because we're so familiar with how the lats act on the back or where they are on the back, but we don't have much knowledge about it attaching to the humerus and that it actually does that medial rotation in there. Okay. So it does this movement here. Now, if this is from your lats and your pecs, and then the third one, the subscapularis, if those muscles are all tight in there, of course, it's going to limit your range of motion. You're going to have issues with your posture. All of those things can occur just from this guy having that dysfunction. Okay, just stay. All right. just from this guy having that dysfunction. And the other thing too is this guy, and it's not shown, but the teres major in there, that does a lot of the similar movements as our lats do. All right. So our lats are going to do that medial rotation. They'll do shoulder adduction. So they'll do this movement here. They're going to do shoulder extension. So you bring your arm back in that way there. So there's a lot of movements that we do with our exercises that involve this muscle that maybe we're not even aware of. Okay. So we're creating added tension in our lats. Okay. That tension over time, if we don't work on stretching and releasing our lats, it can cause us to be this way here. You see a lot of guys, meatheads walking around like that, them tight ass lats and pecs. All you got to do is just take your finger and just jam it right in their pecs and make them cry. Okay. You have to work on releasing these muscles. All right. Again, you can use a lacrosse ball for that as well. You can put it against the long side, probably be pretty tender. You want to get where the attachment is, especially. You can get the back as well, but you definitely want to make sure you're getting up at the attachments. Okay. And you'll get that teres major in there, teres minor as well. But right up in that attachment is where you want to focus when you're rolling out your lats, if you do have some shoulder pain. All right. So to that point too, we'll talk about the subscapularis. This is a rotator cuff muscle. Okay. It's underneath that shoulder blade. It's a tricky muscle to get to, but it's also a muscle you will not feel pain. You will not feel pain here until there's pressure. All right. I've never had someone come in complaining about subscapularis pain. All right. That never happens. It'll be by way of their shoulder, there's something wrong with their shoulder, or they have limited range of motion reaching backwards or upwards. Or the other one is they could have some type of pain down their arm, down into their wrists as well, because there are trigger points that can refer pain down the arm. So never do they say they feel pain in this muscle. All right. So we need to make sure that we are releasing it because it is a medial rotator. Okay. So this does that movement there. You add in exercises that have medial rotation. So anything like this, where you're doing the flies, where you're getting that internal rotation, that muscle is going to be influenced. Again, if we get this muscle nice and tight, our pecs nice and tight, our lats nice and tight, yes, we are 100% going to have shoulder issues. Okay. So again, we got to make sure we're releasing this muscle. What I have my clients use is a massage stick for that. Okay. So you find the back, you find your shoulder blade, which is right in there. You gotta go towards the armpit and press down in there. Feel that shoulder blade. It'll probably be pretty tender. You can move the stick around. You can move your arm around as you're doing it, just to help increase that range of motion as you're moving your arm around. Okay. But that's something you have to do. You have to start releasing those muscles if you want to start having more effective, more efficient workouts. All right. Once you get these released, you'll notice there's a lot better. You'll notice there's a lot better range of motion. There's a lot less pain, especially when you do that bench press and you press. As you start to press up, you'll feel a lot less pain kind of in that crease of your shoulder, because that muscle can cause that pain a lot of times. All right. So release those muscles. I promise you, you will start feeling a lot better. But you got to do it before you work out to get the blood flowing, and you got to do it often. All right. So it's not just a one-time thing. All right. Start doing these things. Okay. I talked about it. Release your pecs, lats, and subscapularis prior to your workout. Again, we want the blood flow. We want the oxygen flow into those muscles, so they're contracting and releasing during the exercises that we perform. Communicate with your muscles. All right. So this is something that's overlooked. A lot of times when we do our exercises, like a bench press, or if we do our pull downs, we're not focusing on our muscles that are doing that action. We're just focusing on doing the exercise because we think it's doing the muscles it's supposed to be, working the muscles it's supposed to be. But a lot of times it's not, okay, because we're not communicating, or there's a lack of nerve activity to that muscle because it's been so inactive for so long. So your other muscles that are assisting with that movement, those muscles are doing more of the work, okay? So what will happen is, like I said with the bench press, is we'll do our bench press but we'll just get all that deltoid work. Okay, so we won't even feel anything in our pecs. So start communicating with your muscles. All right, subconsciously tell yourself to activate your pecs as you're doing your pec workouts. Same thing with your lats. Focus on getting that lat activation. Get that nerve stimulation into those muscles as you're performing those exercises. All right. And the other thing to that too is you need to slow your reps down. Okay. Not everything is about speed. Everyone just wants to muscle through everything. When you do things so rapidly, that's going to be a lot of joint force. Okay. That's going to be a lot of force at the joint. Like I said, your body's going to use the strongest structures available to perform an action. If we don't give our muscles enough time to react or respond to that force, then it's going to be all at the joint. All right. You'll notice a lot of CrossFit people, they have a lot of tendonitis, a lot of joint issues because a lot of their movements are herking and jerking. All right. That's stress on your joints. Slow your reps down. Feel your muscles engage. Make sure your muscles that need to engage are engaging, and that's how you're going to start having better exercise routines. That's how you're going to have less pain, and we're getting that concentric and eccentric action. Okay, so it's not just about the up, it's about the down as well. Okay, so do those things, do them regularly. I promise you, you will notice a difference in your workouts. You'll notice a difference in your levels of pain. You'll notice the difference in how your range of motion or in how your shoulder is functioning. All right. I promise you, I do this stuff all the time with my clients, and it works 100% of the time. 99% of the time. All right. So yeah, longer than I wanted it to be, but it's important stuff. So I'll see you on the next video.